Now I am going to discuss the lateral palpation of shoulder girdle. So here again I have marked all the landmarks. This is your acromial angle. This is complete arch of acromion. This is the spine of acromion or anterior tip of the acromion. So, and this is acromioclavicular joint. So basically in lateral section or lateral palpation technique of shoulder, only these three landmark is important. So let's start with the palpation of the acromial arch. Basically it starts from the angle of acromion, which is I have marked here. So first you palpate your finger pad over the posterolateral aspect of shoulder joint. So place your finger pad like this and perform this circulatory grip. You will feel a small bony rounded bulging structure will be there. So this is the angle of acromion. Basically this point is differentiate between the spine of scapula and arch of acromion. So now I can feel the further from posterior side or from the angle of acromion up to the anterior tip or spine of acromion. Even if you further palpate it, ultimately we will reach over the acromioclavicular joint. So basically this section is lies in lateral side. So first is palpation of arch of acromion. There are two different methods. Either I can place my thumb pad over the margin of acromion and further just follow the complete arch anteriorly up to the spine of acromion. Okay. Another method, either you just place your finger pad somewhere just inferior to the joint line or the lateral aspect of the arm and then apply little pressure and slide it in upward direction. See, I can feel the complete margin of arch of acromion. See, and this is the accurate method for identification of bony edges. Another alternative method is there that just apply the pressure in downward manner over the arm of the patient. See, a depression is created over here. Relax. You can see the movement or you can observe over here because of the separation of arch of the acromion and head of the humerus, a depression will be created over here. Because I have already marked it, so it is not clear. But even though to some extent it is appearing. So this is the method of identification of arch of acromion. Next, if you further move in anterior side, ultimately you will find a bony projection for the anterolateral aspect of the shoulder. Basically, it is the spine of acromion. Next is acromioclavicular joint. So again, for the identification of acromioclavicular joint, there are different approaches. Either we have to place the hand flat over the superior aspect of the shoulder and perform this circulatory palpatory technique. Identify the most prominent bump over the shoulder or superior aspect of the shoulder. See, this is the most prominent part over the shoulder tip. So basically it is not acromioclavicular joint. It is formed by the lateral end of the clavicle. So I just place my thumb pad for the lateral end of the clavicle. Now slide your thumb pad laterally. A little distance will be covered, very small, and then you will feel that the thumb pad is going in a inclined manner, or it is going in downward direction. So just place and maintain the little amount of pressure for this area and perform the abduction and adduction of the shoulder joint. Just perform it, just maintain this grip, and you will feel there will be gliding movement between the lateral end of the clavicle and acromial facet. So this is the exact location of the acromioclavicular joint. The next structure that we can palpate in lateral direction or lateral side of the shoulder, that is this is the single muscle, which is your trapezius. Some fiber of the trapezius which basically insert over the clavicle. So by palpating the edge of the trapezius, we can reach up to the posterior margin of clavicle, lateral end and posterior margin. So these are the structures which are basically found in lateral palpation technique of shoulder joint.